Hello, this is Dr. Sal, Nuarch Dental Implant Center, Nuarch by Dr. Sal, and welcome to this new video. In this new video, we're going to talk about why is it so hard to live with dentures. Many of our consults have patients that come in to meet with us. They are either using dentures, they are at a choice where they either have to use dentures or they're looking into implants. And I'm not a denture wearer. I have family members that are, but I certainly meet with many patients that have been using dentures. And I, as a implant dentist, I will give you my take on it. And you can imagine that I probably won't be praising the denture much. But there's a reason for it, and I want to give you my unbiased opinion of what I think about dentures. So this is one question we get often. Is denture a permanent solution for edentalism or toothlessness? Well, it depends. So it is meant to be, it's an option to replace all teeth if we're talking about a full denture, or if it's a partial denture, it's some of the teeth that are missing. If some teeth are present, then that's called a partial denture. It's a solution. However, the success of it depends on quite a few factors. And I would say number one factor would have to do with the base of the denture. It's an ever-changing place, which is the gums. Underneath the gums there is bone. So patients will often come to will complain about their dentures, and their number one complaint is that, this denture used to fit perfectly, and because of such and such it doesn't, I lost some weight and it doesn't fit anymore. Well, the truth is they're witnessing an ongoing process of the body, and it's called disuse atrophy. So any organ in the body, any tissue in the body that's not being used and stimulated is bound to shrink. With some people it's going to happen faster, with some people it's going to happen slower. Depends on how long an individual lives, depends on how their bone structure is, but it is something that just happens. It's called disuse atrophy. It's the main reason why dentures start to feel bigger than last year. They always feel bigger. And that's because the base bone that's supporting the denture, which is about under the gum, is shrinking because there's just no roots left in there, and the body has no reason to keep it like that. So I guess the answer to this question is that is it a permanent solution? Well, it may be, but does that help the quality of life and the enjoyment of the individual, the person, to go about their business and really fully enjoy life? I have to say I doubt it for most people, especially if they have gotten into it later in life. I've met some patients that they received dentures when they were young and there was no other option for them, so they had just clearly no other option, so they had to live with this. So it's a mindset thing, and they accepted it. Sometimes they put it in, sometimes they don't, and maybe they feel that this is their destiny, and maybe they're not even aware, many of them, that there's an option for them. So that's a mindset thing. And why do people talk different when they have dentures in their mouth? Well, I guess it's a self-explanatory. It can be self-explained. If you take a look at a picture of a denture, you'll see the size of it. And for the upper, it's going to fill in the palate pretty much everywhere on the top jaw so that it can stay in. And there's really nothing that's going to hold it in for the top denture other than suction. So it has to trap air or stay in with glue, and it has to push against gum tissue. And under the gum tissue there's bone. So if there's any sharp edges, well, that's going to be a problem. But that's basically how it all holds on the top. On the bottom, it gets even trickier because you got the cheek, you got the tongue, you got everything working against the denture, and there's no real suction like the top. So most people that I've met, if they're completely edentulous or no teeth present, they don't really use it that much. That's been my observation. So, like, another question that we see is that what's the chewing ability like with dentures versus implant teeth? So, I would have to say there's no comparison, because when you have the all-on-4, all-on-X type of teeth, they're attached to the jawbone, so there's no discomfort when somebody chews, and the material is a very strong material, so it can cut very, very effectively. So they can eat whatever they want, pretty much. Now, on the other hand, with a denture, people eat things, of course, but the issue is it's not supported by implants, so therefore it has to bounce. So they have to always think about what they're eating, and they have to keep it balanced. It's kind of like riding a bicycle. So if you're putting something on the right side, and if it's a big piece of food, well, that can cause some imbalance and lose the air section, and the denture may just come off. So that's the issue with it. So can things be eaten with dentures? Obviously, they can, but I would say the effectiveness of chewing, there's just no comparison. And so that's the answer for that. So overall, I think people who are looking into dental implants, there's something that's bothering them, and maybe they have these problems or these frustrations that I've mentioned. Maybe they don't, but it's dental implant teeth is clearly a better solution for chewing and for smiling, for life, really, basically. It's a much better option. And if you have any questions, please feel free. Send them to us. We're happy to answer them. And anything to do with dental implants or full arch dental implants, this is all we do. And thanks again for watching. This is Dr. Sal from Nuarch Dental Implant Center. Nuarch by Dr. Sal. Thank you.